Assalamu alaikum and welcome to today's lecture in medical research. One of the biggest challenges students and researchers face is choosing the correct statistical test. The decision often depends on the study hypothesis, types of variables, distribution of data, number of groups, whether the data are paired or unpaired, and study design. In this video, I will guide you through a simple and step-by-step practical decision-making flowchart that will help you instantly select the correct statistical test for your analysis. Statistical test selections depends on the selection of a statistical test depends mostly on the research question objective hypothesis, study design, and the type and the distribution of data. Research question. Are you looking for differences between groups, relationship, or association between variables, or predicting an outcome? Identify variable types. Determine if your independent and dependent variable are continuous, blood pressure, weight, categorical or nominal, disease, presence, yes and no, or ordinal, for example, pain scale rating. Consider study designs and groups. Are the groups independent, unpaired, treatment-based control group, or paired matched? For example, before and after measurements on the same patients, how many groups are you comparing two or more than two groups? Check assumptions. For continuous data, determine if the meets parametric assumptions, primarily normal distribution and homogeneity of variance. If not, use non-parametric alternatives test. Step 1 for selection the statistical test. Identify the type of variable. Types of variables if numerical or continuous like blood pressure, hemoglobin or cholesterol levels. If the data types is count, number of death, number of motorbike accident, or categorical data, nominal, gender, blood groups, smoking status, ordinal, Likert scale, or severity of pain level. Time to event data, survival time, recurrence time. Step 2 for selection the statistical test. Check distribution for numerical data. Normality. Use normality test, Shapiro-Wilks, histogram, and QQ plot. If normal, use parametric test. If not normal, use non-parametric test. Step 3 number of groups. How many groups are you comparing? Number of groups, 1 groups, 2 groups, or 3 or more than 3 groups. Step 4 decision flow for numerical outcomes. Case 1 1 group, 1 sample test, normal data, 1 sample t-test, non-normal data, 1 sample Wilcoxon signed rank test. Case 2 2 groups independent, 2 independent groups if data follows the normal independent t-test use not follow the normal distribution use Mann-Whitney U-test. For example, compare mean HB between males and females. Case 3 2 groups paired. Paired groups If follow the normal distribution, use paired t-test. If data does not follow the normal distribution, use Wilcoxon signed rank test. For example, pre-test with post-test scores. Case 4. 3 or more groups. More than 2 groups. If data follow the normal distribution, use one-way ANOVA, or data does not follow the normal distribution, use Kruskal-Wallis test. For example, comparing mean cholesterol in 3 BMI categories. Step 5. Decision flow for categorical outcomes. Categorical variables choose based on numbers of groups. Two categorical variables, chi-square test if assumptions met, Fisher exact test, small sample sizes. For ordinal data, chi-square, linear trend test, Mann-Whitney U or Kruskal-Wallis test may apply depending on the scenario of the study.
Please subscribe and like our channel and press bell icon for more videos.